In my village, there is a woman who got to know that she's pregnant at 7 months. Can you imagine? And there are several of you I know out there who may not understand that they are pregnant, yet they are. I've received several questions in my inboxes, people telling me, Doctor, I'm doing this, I have this. Do you think I am pregnant? And some of them are false signs and others are really true signs. Welcome to Ask Dr. Uthuman YouTube channel, a channel where we learn medicine at the comfort of your living room. And today we are talking about the signs of pregnancy. It looks simple. Everyone look at, hey, why is he teaching about the signs of pregnancy? But it's very important because there are several women out there who do not know the signs of pregnancy. And by the way, the worst thing is that a woman may be pregnant, they go to the hospital, they are given medicines that are not supposed to be given in pregnancy. Why? Because the doctor, the patient, they do not know that this woman is pregnant. So, in this particular video, we are looking at the signs of pregnancy. And number one, the cardinal sign of pregnancy is missing periods. The moment, because you will be knowing that I'm supposed to be having my periods on second, on third, on fourth, because you've been calculating or you've been aware of the length of your menstrual cycle. You've been learning, you've been studying your menstrual cycle. Now, if that day comes, you don't see periods. Wait for the second day, the third day, suspect. There is a suspect inside your belly. So you are likely to be pregnant if you miss your periods. However, there are some other conditions, there are some diseases and some other conditions that can lead to missing of periods when someone is not pregnant. For example, when a woman is undergoing stress. When you are stressed, at times there is some hormonal interplay that can lead to missing of periods. And again, there is just, at times it's just a delay. Delays happen in the body because of those hormonal fluctuations and so on. And then you delay by maybe 5 days. So you may think you are pregnant when you are not. Another issue may be hormonal imbalance. Maybe a woman is using family planning methods like the birth control pills, the levonorgestrel medicines like the implants and so on. A woman may miss her periods just when it's not pregnancy. Then another issue. So in this, what we are trying to discuss, if you find at least 3 or 4 signs, when you have at least 3 or 4 signs, then there are very high chances that you are pregnant. Now, if you miss your periods, number 2, you get breast tenderness. The breasts get tender or a little bit painful and they swell or they grow big, they enlarge in size. Then it is also a predictor that you are probably pregnant. Then another sign which is very, very important is nausea and vomiting. Nausea and vomiting. Actually, it's nausea with or without vomiting. You know, I'm a fan of some Nigerian movies. And in Nigerian movies, the only sign of pregnancy is a girl vomiting. And I don't know why. I think Dr. Marach from Nigeria should tell me why these women usually vomit when they are with elders. They are seated with their mother, their elders, and so on. And then they run to vomit. So that is, for them, it's the sign of pregnancy. So vomiting, nausea and vomiting is one of the major signs of pregnancy. Now, just imagine a woman has missed her periods, she has breast tenderness, she has nausea and vomiting. Hello? You are likely to be pregnant. Around 90% of the chances are that you are pregnant. Then there is another sign which is increased frequency of urination. When a woman gets pregnant, the number of times they're supposed to go and pee increases. A woman who was going to the looses only 3 times in a day, they will start going there almost every hour. Almost every hour they want to do susu, they want to urinate, and that could be another sign of pregnancy. Then another interesting sign is moodiness, mood changes. These women become moody. They become moody. Whatever they are looking at is disturbing them. And most of them will find them, they don't want to even see their husbands. They don't want to see their spouses. So that mood change, and this mood changes is brought about by the hormonal interplay, especially that hormone called progesterone, which is the hormone of pregnancy. Then another point here, or another sign you can look at and probably predict that you are pregnant, is the spotting. It's called light spotting. By light spotting, I mean seeing some little blood, a spot of blood, probably when you are wiping yourself. And this could be a sign that you are pregnant. Why is spotting happening? And actually, this spotting usually happens like between 10 in the second week of pregnancy, between 10 and 14 days after fertilization. And this is called implantation bleeding. Implantation bleeding or spotting shouldn't be too much blood. It's just very light blood. And now, another very important factor here is food aversions. I don't know what happens. Most women, when they become pregnant, they get sensitive to different tastes, to odors and tastes, and this is what brings about the craving activity in women. You find that a woman wants to eat berries, they want to eat this, they don't want this. And you find that they'll crave for items, I don't know. And this is very interesting. Currently, we are seeing women craving for cars. I don't know how a car is now related to the food aversions, but some of these, I don't know. They're hard to explain. Now, in the comment section, I want women, most of you, to tell me, whoever has ever gotten pregnant, to tell me, to write for me the signs they got, which signs they got during pregnancy, and also what they craved for. If you craved for a car, be very sincere and also put it there that you craved for a car. Now, another point which I can talk about is increase in the heartbeat, increase in the pulse. Wow, this is very interesting. But in my village, actually, when a woman, when the parents detect or start thinking that the girl is pregnant at home, then they will call you, come. Then they check on your neck to look at that pulse. When they see it pulsating too much, very fast, they say, aha, this one is pregnant. And when you go to the hospital to check for your urine, they will confirm that you are pregnant. So these, all the traditionals, these women, or those long ago people really knew that sign, that when there is an increase in the pulsations in the heartbeat or in the pulses, if there is that increase, then you are likely to be pregnant. And what brings about this? And this, I'll add up this on the increase in the blood pressure. Most women, during pregnancy, there is the way the blood pressure increases. What happens? It's because of these the hormonal interplays will bring about the positive inotropic and positive chronotropic effect. By these terms, I mean the increase in the heartbeat, and also the amount, the contraction, the increase in the contraction of all the contractility of the heart. And when there is an increase in the contractility of the heart plus that fast beating, then we shall have an increase in the pulse and the rate of pulsation, and we shall also have an increase in the blood pressure. However, you shouldn't take this for granted. When there is an increase in blood pressure, you shouldn't only be thinking about pregnancy, because there are some other diseases that can cause increase in blood pressure. And again, we should also not confuse this sign of pregnancy to other diseases of pregnancy. What do I mean? There are diseases of pregnancy that are related to hypertension or to pressure. For example, if you have been you've not been hypertensive, you've not been having high blood pressure, and then blood pressure increases, we can call that hypertension in pregnancy. This one we are talking about, and it's just a slight increase in the blood pressure, which will wear off in a few days, and then it doesn't cause even any damage to the body. But there is what we call hypertension in pregnancy, whereby a woman develops hypertension or develops pressure during pregnancy. This is different. And then there is also what we call preeclampsia. What is preeclampsia? By preeclampsia, a woman at 20 weeks, when a woman reaches 20 weeks, there is an increase or a shoot in the blood pressure, plus some other things which can be detected in urine. But me, I'm talking about the blood pressure. So this is preeclampsia. So this is not what we are talking about. We are just talking about the slight increase in the blood pressure, and then that slight increase in the pulsation. Because what I was telling you, what my grandmothers or our grandparents were looking at was the carotid here. So another point we can talk about that can show you that you are probably pregnant is the temperature change. You know, this, I talked about it when I was discussing about the ovulation. We measure the basal body temperature. The temperature, your body temperature when you are at rest. When you've been, like, you measure it in the morning, after waking up, before doing anything, you measure your body temperature. And you realize that if you've been checking your body temperature several times, you'll find that there is a slight rise in the body temperature, and this is one of the signs of pregnancy. Now, this is a very interesting sign, pregnancy glow. Most women actually, when they have just conceived, in the first trimester, in the first 3 months, they have that glow, they have that radiant look, they look so beautiful, they look so nice, they have that luminous look, and that is because of the hormonal interplay. Because remember, I told you that when a woman gets pregnant, there is an increase in the blood volume. Because the body, first of all, I talked about the positive inotropic and positive chronotropic effect. What do these mean? They mean increase in the heart rate and also increase in the contractility. Now, those activities will also increase the blood volume, the blood that is reaching the peripheries. I hope you're not lost. I'm talking about when there is an increase in blood volume, the blood circulating the body parts, the peripheries, there is also an increase in the blood that is supplying your skin. And again, there is also an increase in the hormones in the blood. Therefore, that glow is brought about by that increase in blood on different surfaces, and then a woman will have that very luminous, or what we call the radiant look. But this may phase out when you reach the second trimester. By the time a woman reaches 5 months, 6 months, 7 months, hello, you may not want to look at them. So at times this radiant look may phase out as time goes on. But when a woman has just conceived, she looks so nice and pretty. So another sign is the breast changes. The breast changes. Of course, why are the breasts changing? Why? They will grow big, they will enlarge because they are preparing to breastfeed. And now there is also an action by the prolactin hormone. Prolactin is also trying to prepare itself so that the baby will gets enough milk. Let me tell you, actually, even when you find a 12-year-old girl, when a 12-year-old girl conceives, even if she has been having very tiny breasts, the breasts will start growing miraculously, and by the time this girl is giving birth, the already breasts and the breasts are filled up on the chest, and the baby is able to breastfeed. So that change will happen. Another change is called acne. The pimples. Most women will get pimples during pregnancy, and it is not a very big issue. Don't go getting drugs to treat and so on. You'll just spoil your skin. Just leave them, except if they are really causing a lot of damage. Another issue is about weight gain. Weight gain. This is self-explanatory. Why? Because 1, there is a fetus. There is a fetus in the uterus. 2, there is the amniotic fluid. The fluids that are supposed to be where the baby is supposed to bathe. We talked about increase in the blood volume. We talked about the positive chronotropic and positive inotropic effect, whereby there is that increase in the blood volume. So there is an increase in the hormones, the number of hormones circulating the blood, trying to keep the pregnancy and so on. So I guess you expect that we shall have an increase in the weight. There will be weight gain. Another issue is about nasal congestion. This may not be a very serious symptom, but if you see that, especially in those early months, then get to understand probably that you are pregnant. Especially you've not been having flu, nobody has flu around you, and you start getting that nasal. You don't have allergy, you're not asthmatic, then you get stuffy noses. If you get a stuffy nose, then probably there is a pregnancy. Why? Because I talked about an increase in the blood volume, and when there is an increase in the blood volume, it will also stimulate, because the blood will also reaches the nostrils, the blood vessels in the nose and so on, and then there will be secretions in the nose, and at the end of the day, you'll have those stuffy noses. Then another issue is about fatigue. These women, when a woman gets pregnant, every time she feels she's getting tired, every time I'm tired, they are losing energy, so that is also one of the signs. And most people call it morning sickness because they try to combine this fatigability or fatigue with the other nausea and vomiting, and those signs usually happen in the morning. A woman wakes up, actually, one of the major signs, in the morning, a woman who was waking up at 6 a.m. to go and do work, they feel like they don't want to leave bed, they wake up at 8, so that is one of the signs that this woman is pregnant. Then another sign is bloating. If you've not eaten anything dirty, you don't have ulcers, peptic ulcers, you've been deworming yourself and you start getting those funny bloats, then it may be a sign that you are pregnant. Constipation, same as bloating. But now, all those signs can happen. However, you've not yet confirmed that you are pregnant. All those signs can happen, but you've not confirmed that you are pregnant. Maybe another sign we can talk about is cramping, light cramping, or lower abdominal pain. Some women will experience that lower abdominal pain, but it should be light. When the pain increases, then it can be a sign that that baby is going to be miscarried. So it can be a sign of abortion. But there should be that very light lower abdominal pain, which anyone can bear with. Now, even when those signs, what I was talking about, even when all those signs are there, it doesn't confirm that you are pregnant. You have to do a urine pregnancy test or a blood pregnancy test. And when, these kits can even be, you can even do it from home. You don't need to go to the hospital. Buy your kit from the pharmacy, put your urine there, and when you get 2 strips, celebrate, you are pregnant. And again, you can also want to confirm this good news. You go on and do an ultrasound scan or any other scan. There are several other scans, and it will be able to confirm that you are pregnant. If you are watching this channel for the very first time, please do not forget to subscribe and also press the notification bell in order to be notified of any video we upload. And if you'd like to get in touch with me to have a private chat, a private conversation, just go to my website www.druthuman.com and have an appointment. Book your appointment. I'll be there to chat with you. And you can also find us on all our social media platforms, Facebook, Twitter, every social media. We are there, and the name is Ask Dr. Uthuman. Don't go away.
Ask Dr. Uthuman on Sawa